Hello and welcome everyone to today's webinar on protection standards in humanitarian assistance. I hope that you are all well, and I'm happy to see that not only German but also a lot of other NGOs from a lot of different countries are taking part today. Very welcome to all of you. My name is Caroline Kräling. I am Policy Advisor on Humanitarian Assistance for FENRO, which is the German NGO umbrella organization. I will guide you through the webinar today, and I would like to welcome our two speakers. The first one is Tanja Funkenberg from Terre des Hommes. She is Child Rights and Child Safeguarding Officer, and she will talk about the Child Protection Minimum Standards. Our second speaker is Hakon Spriewald, Project Coordinator for the project Leave No One Behind at Humanity and Inclusion, and he will tell us a little bit more about the inclusion protection standards today. We won't focus on protection in general today. I hope that you bring a little basic knowledge on this, because we will directly go into the two standards, Child Protection Standard and Inclusion Protection Standards. Now I would like to hand over to our first speaker, Tanja. She will talk about the Child Protection Minimum Standards. She will give a short overview and then also talk about challenges and recommendations for you. So Tanja, go ahead, please.
Yeah, thank you very much, Carolina, and welcome everybody to the session of this webinar. And my topic today is the minimum standards for child protection in humanitarian action, and I will basically present the publication of the Alliance. But let me start with some introductory slides. Humanitarian crisis. What is a humanitarian crisis? We speak of two humanitarian crises. One is caused by humans through conflicts or civil unrest. The other one is caused as a result from natural disasters such as floods, earthquakes, or the outbreak of infectious diseases, like we actually have now these days during the coronavirus pandemic. Or it's a combination of both. And in both cases, normally humanitarian crisis has a devastating effects on children's lives. And the objective of humanitarian action are to save lives, alleviate suffering, and maintain human dignity during and after disasters, and strengthen preparedness for any future crisis. Child protection. What do we understand under child protection? This is the prevention and the response to all forms of violence against children. And we talk of physical violence, emotional violence, sexual violence, neglect and exploitation. And our emphasis should be always on the prevention of any form of violence. But in case of an incident of violence, of course, we should respond quickly and appropriately. So what are child protection risks specifically during humanitarian crisis? During a humanitarian crisis, often family will be separated and children will be there on their own without any parents or caretakers. All children are recruited into armed forces or armed groups. They experience physical or sexual violence, psychosocial distress or mental disorders, or they are economically exploited and they face injuries and death. So what means now child protection in humanitarian action? In most disasters and conflict contexts, children make up the largest part of the affected population. So therefore, child protection actions include specific activities conducted by local and national and international child protection actors, but also by non-child protection actors. So meaning even other actors for other sectors like WASH or food security need to be trained in child protection measures. And child protection is an area of responsibility within the global protection cluster. So I would like to present the Alliance, which is a global network of operational agencies, academic institutions, policymakers, donors, practitioners, and working in the field of humanitarian action with the objective to protect children. So its mission is to support the efforts of humanitarian actors to achieve high quality and effective child protection interventions in both refugee and non-refugee humanitarian setting. And the Alliance achieves this primarily by facilitating interagency collaboration on child protection and also producing technical standards and tools. And one of these standards I'm going to present to you today. The minimum standards for child protection in humanitarian action. There was a new second edition that was published last year, and it was a work of several individuals, agencies from various countries, and children were also consulted to produce these standards. Yeah, in light of the current coronavirus pandemic, I would like also to mention two publications of the Alliance, which I'm not going to explain more, but you have the links here on this page. The one is a technical note. This was just published a few days ago. The protection of children during the coronavirus pandemic, and another guidance note, which was published already earlier, the protection of children during infectious disease outbreaks. During my presentation, I will a little bit refer to the coronavirus pandemic and the risks and maybe the measures that have to be put in place, but it will not be my main topic. Here are some more links. I thought because of the current crisis, it's good to put it here in case you're looking for more information on this. Yeah, the minimum standards, in fact, they cover 28 standards across 4 pillars with 10 principles in order to establish common principles among all actors during a humanitarian crisis and to strengthen coordination between humanitarian actors, to improve the quality of child protection programming and its impact on children, to improve the accountability, to define the professional field of child protection, provide good practices and strengthen advocacy and communication towards the public, towards donors, and so on. This is a nice overview, I think. You see the outer frame, which are the 10 principles, which are threaded throughout all the standards. And in the middle, you can see the 4 pillars, or in the 4 columns. The first pillar is all on providing quality response. The second one is listing all the protection risks for children. The third pillar is giving adequate strategies. And the last pillar are standards to work across sectors. So first, let me talk about the 10 principles. They all have equal weight. And in the middle, you can see the 4 principles derived from the UN Child Rights Convention. They are the principles of non-discrimination, child participation, best interest of the child, survival and development. And then you have surrounded the principles from the Sphere Handbook. They are safety, dignity and rights, access to impartial assistance, and the assist to recover, help people claim their rights, also access to legal support, and strengthen child protection systems. The strengthen child protection system and strengthen child and children's resilience were new principles established for this child protection minimum standards. So all principles should be considered when applying the standards and the various actions. So how to, for example, include child participation in all the actions we are doing to assist and protect children during a humanitarian crisis. Yeah, let's start with Pillar 1. This is all about to ensure a quality response. So you have the coordination, human resources, communications and advocacy, program cycle management, information management, and child protection monitoring. They are, of course, complementary to the core humanitarian standards, which has 9 commitments. And this standard 1 is on coordination, of course, in both cluster and refugee settings. And for example, standard 4, the program cycle management, in this case, you include also child protection measures. For example, in the design and planning of a project, you include, for example, a child protection risk assessment. And the results of the risk assessment will flow into the design of the project. There's a stronger emphasis now in the humanitarian action on safeguarding and also on the prevention of sexual exploitation and abuse. So Pillar 2 actually lists 7 major child protection risks during a humanitarian crisis. They are specifically affected for, of course, dangers and injuries, physical and emotional maltreatment, sexual and gender-based violence, mental health and psychological distress, children associated with armed forces, armed groups, child labor, and unaccompanied and separated children. And in this Pillar 2, of course, a child may experience multiple risks at the same time, and we normally need to implement measures that prevent various risks and respond to any incident. I will get back to it again later. For example, when we develop now adequate strategies to prevent and respond to protection risks. For example, you can see here the socio-ecological approach in the diagram. So first of all, a child should participate or be strengthened and be resilient also to protect themselves, or to empower children to protect themselves. And they are part of the family, not always the close relationships to parents, but also the wider family. And the family is nested in a community, and community is part of the society. So we have to look at a systematic and system thinking approach. And group activities for child well-being, this is not, for example, the child-friendly, set up child-friendly spaces and offer activities for children, and strengthen the family and caregiving environments, meaning also include parents in the protection activities and also key stakeholders, for example, from the community. I will give an example later when I talk about a project, so I will come back to some of these standards. In Pillar 4, we have the child protection risks to work across sectors, meaning we have to have an inclusive approach. And because child protection risks are closely linked with the work of other sectors, like they are listed here on the left side. And for example, also now during the coronavirus pandemic, the schools are closed and many parents can't go to work. So some families are even in quarantine. So they are actually having no access to schooling facilities, maybe also to advice and support, or it's difficult when they are in quarantine and the parents have no income. So this increases the risk of child marriage and also of child labor. And the good thing is, in the past, there is an increasing recognition of the centrality of protection across all sectors. It highlights actually also in the booklet on this very pillar, you see that there are negative impacts of sectoral programming when child protection measures are not considered. Yeah, I would like to come back to one of our projects, and we are implementing several projects in North Iraq. on education and psychosocial care for internally displaced children and refugees. And for example, Standard 15 on the Pillar 3 is to offer child activities and group activities. We set up child-friendly spaces in a camp setting. And camp setting is normally a little bit easier than in a community setting, as it is not so complex as a whole community. We have a close coordination with the camp management to run this child-friendly space. And as there are lots of children, we have to split our offers into several batches. So at one time, we can offer activities for 100 children in 2 shifts, 3 hours in the morning, 3 hours in the afternoon. And we have like the journey of life, certain games, which also have an aspect of psychosocial support. To give a child a safe place and a structured day-to-day life, it helps already to overcome this traumatic experience. So it is very important to have a safe structure where a child can come every day. A little bit unfortunate is that we cannot offer, of course, the activities to all children throughout the time. 2 staff members, they are taking care of 25 children. We have a woman and a man in place, also from different backgrounds, a Yazidi woman and a Muslim man or woman. Though the children are all Yazidi children, but this is also as a role model for social cohesion for the society. And as I said, Standard 16 says take into account the parents or the close environment, the caretaking environment of a child. So we commit the parents to attend meetings while the children are in the child-friendly space in order to find out what are the problems at home and to understand also the behavior of the children, or to teach the parents and explain why maybe a child has changed the behavior during the crisis or after the crisis. So typical symptoms are nightmares, bedwetting, or regressive behavior. And sometimes parents don't know why a child is behaving like this and maybe reacts with anger or even using violence. So we give a psychoeducation to parents. So it's in a two-way, that on the one hand, we listen to their problems. On the other hand, we can teach them how to encounter the problems. How do we select the children? First, we took in children that are not attending public schools, but also we consider, of course, a lot of vulnerability criteria. For example, children with problems, or child-headed households, children with mental and physical disabilities, early marriages, and child labor, teenage pregnancy and teenage mothers, or children who are affiliated with armed groups or who have experienced sexual or physical violence. In our work in the community setting, we do also a selection process. But as we don't have the camp setting, we now have to go from door to door and assess each household and identify vulnerable children. This is done by 2 community mobilizers. They are coming from the neighborhood, so they also know already the houses and the families, can have the trust also usually from the neighborhood. We also set up a parent committee, for example, to accompany children to the center. For example, in the community setting, there's a risk of high traffic. So we have set up this parent committee. And we have local caregiver committees. Key actors like policemen, religious leaders from the community are part of this committee. And of course, one of the NGO staff is part of the committee, as well as a youth. And usually this youth brings in child protection concerns. He or she knows the situation of the other children in this community. When it comes to recruit staff members for the child-friendly space, we have an open process for application, but we do interviews with each of the applicant. If there is a police clearance certificate, we ask for this police clearance certificate to see is there any relationship of this person, or has he committed any crimes related to children or committed any violence to children. But the positive thing is really staff members are coming from the community. They have many contacts to families and know about the problems. And the NGO that we are working with has been in the community for over 5 years. So this has built trust. This is unlikely in a humanitarian context. Usually NGOs or international NGOs are coming in new and don't stay long. And this was a big advantage that this NGO has already long time experience and the trust of the community. As Terre des Hommes is an organization that works only through local partners. And of course, we train all staff on child safeguarding, on child protection. Yeah, just some few sentences to case management. We normally identify affected children either through this child-friendly space. I mean, who has problems, and sometimes children themselves complain. And in case of domestic violence, the staff of the child-friendly space visits the families, teaches them positive parenting, so they have to agree to rules. And if the child can't stay anymore with the family, we look for alternative ways where the children can stay. In the context of North Iraq, where we are working, the governmental orphanage is no option, as the child protection standards are very weak. Yeah, then cases of separated children, normally UNHCR looks after such children, or in cases of child labor, we offer casual work to parents and get children back to school. So what are the challenges for case management? As I said before, INGOs frequently change. So the treatment for children end before time. And in case there's a new NGO coming in, but the cases usually are lost. So you have to start all over again. And the referral mechanism, which is also a very important element of child protection, to refer to, let's say, medical doctors, legal support, psychosocial support, in this area is very weak due to lack of experts and ineffective local structures. So one of our projects is also to train more persons in psychosocial support, for example, or trauma therapy, to build up local structures in the community. Yeah, in general, I'm coming now to some few more challenges. Of course, the specific situation of humanitarian context is maybe contradicting to try with child protection because of time pressure, limited resources, and a confusing situation. We need to sensitize people for the issue of child protection, but when survival needs are dominating daily life, protection in general and child protection is often an underfunded sector. So we have to advocate and sensitize also donors. The lack of sufficient qualified social worker, for example, when a high caseload, there are not enough social workers to address cases. Then there's also poor salary, which makes it difficult to encounter child protection issues. And we have a fragmented cases and data management. For example, when INGOs change, we lose all the data of previous cases. Yeah, often we also encounter or here and there disagreements with governments because they have their own policy and maybe they are supporting one ethnic group, but we have a broader approach to support, of course, everybody. And yeah, they implement their policy, which is conflicting with child protection minimum standards. Yeah, the institutionalization of child protection mechanisms and is taking place in a very volatile humanitarian context. Yeah, we said we are working together with local committees and build on local structures, but there's a risk of overloading local committees. So we give them tasks, but we also have to see what are the limits. Can they really identify risks of children and do a case management. Normally this is going beyond their capacities and also time and commitment. Yeah, and the properly linking of NGOs' efforts with existing institutions in the local community. Yeah, and there's a lack of still of uniformity of approaches and implementing the standards, especially civil society and government services. And we need to sensitize decision makers for the relevance of child protection. So just some recommendations. We need always to prioritize local ownership of child protection, though it is difficult in the given context, but it means also to train and sensitize on child protection, support and strengthen local child protection initiatives. So set up informal community groups, collaborate with community-based organizations and local NGOs, sensitize government bodies and services, like, for example, workers of social welfare and healthcare staff on child protection issues. And we need to closely link child protection activities to existing national legislation and government ministries. So what is in place also in laws in terms for child protection, for example. And my last slide, provide more funding for child protection as long-term consequences can hamper further development. So normally it has to be included already in a project proposal. Improve mainstreaming of child protection, so meaning the relation to other sectors of humanitarian action, and always keep in humanitarian context a rights-based approach and the long-term aspects. So address structural elements and legislation. And we need to lobby with donors and governments to look into child protection issues on its own and as a cross-cutting issue. Thank you very much. Yeah, this was my part of minimum standards. For sure, there are some questions that have come up.
Yes, thank you very much, Tanja, for your input. I think especially the practical insights into your project work, recommendations and challenges were very interesting. Now we have a few minutes for Q&A. I have already received one question. You have mentioned the child protection minimum standard. There is also the Keeping Children Safe Coalition. And is there a difference between those two standards, or do they merge somehow?
Yeah, Keeping Children Safe has a strong focus also on at institutional level, that let's say every institution or every NGO, also in the development aid field, has to set up a child protection policy. So meaning at the level of personnel management, recruitment of new staff, what kind of measures can I put in to prevent any harm to children? For example, having background checks or police clearance certificates. So it's very much at the level of an institution and the management to how to run an NGO. But and now child protection standards in humanitarian action is more at the level of programs and projects. So when I have a case of a child protection incident, for example, a child is working or involved in child labor, that is of course already doing harm to a child, and I have to solve this case. Whereas Keeping Children Safe is much more looking if there is a perpetrator among the NGO staff, and how do I prevent any perpetrator to enter an NGO to access children. So there is a little bit of a difference. Keeping Children Safe is more at the institutional level, whereas child protection minimum standards is really looking at much broader at a humanitarian setup.
Thank you very much for this clarification. Before we start with our second input, let us quickly go to another important question. What are your recommendations on how to mainstream child protection in a project without a focus on child protection? Like, what are the basic things to do? If you could go quickly into this one, and then we will start with the second input. Thank you.
Well, we say it's not, of course, difficult to give a quick answer, but of course, in any project that we are running, even not if children are not directly targeted, but in the close vicinity, there are always children, especially in least developed countries. A majority of community are made up of children. So even if you provide a well for a community, in the surrounding, there are always children. No? So it's also to set up the venue safe for children, but also look rather at the institutional level. How do I ensure wherever we work as an NGO, even if it's providing a well, that no child will be harmed? So what are the do's and don'ts? No? You have a code of conduct, for example, that even my staff member is not allowed to contact a child or meet a children in a private time or do any form of harm. Now you have to establish, I think this is the heart of child protection policy at institutional level, to have a code of conduct so every staff is informed how to behave properly especially towards children.
Thank you very much, Tanja. So now we will go over to our second input and shift to the inclusion protection standards. So I would like to directly hand over to you. Thank you very much.
Welcome, everyone. Yes. Thank you, Caroline. Thank you, Tanja, for the great start of the webinar. Yes, my name is Hakon Spriewald. I'm working for a project called Leave No One Behind, which is implemented together with CBM and the Ruhr University of Bochum and funded by the Federal Foreign Office of Germany. And today I was asked to give a brief overview on the Humanitarian Inclusion Standards for older people and people with disabilities and the IASC Guidelines on inclusion of persons with disabilities in humanitarian action with a protection focus, with a protection lens on. And I will shortly have an introduction to what we're talking about. What do we mean when we talk about disability? What do we mean when we talk about inclusive humanitarian action? Then going into the actual humanitarian inclusion standards with a focus on the protection inclusion standards and connect them with the IASC guidelines. And then in the end, the same as Tanja, talk a little bit about challenges, general challenges, and general recommendations also on how to mainstream disabilities. So similar as the question was for how to mainstream child protection, how to mainstream disability across the sectors, especially for organizations who don't have a disability focus. All right, let's dive into it. So what do we talk about when we say disability? So what is disability? How do we understand it? And we are basing our understanding in general on the global landscape, the understanding of disabilities based on the United Nations Convention on the rights of persons with disabilities, which says that on the one hand, disability is an evolving concept. So it's not a static concept. It is changing over time. The more we learn, the more we identify. But disability results from, on the one hand, the interaction between persons with impairments, so persons with long-term impairments. This can be sensory, physical, intellectual, or psychosocial impairments, in the interaction with attitudinal, institutional, and environmental barriers. So barriers which are not connected to the person, but are connected to the environment around the person, which hinder the full and effective participation of the person in society on an equal basis with others. And this is really the heart of the concept of inclusive humanitarian action. We are looking especially on the barriers that hinder the participation. So this is our focus. when we talk about persons with disabilities. And when we talk about persons with disabilities as well, we mean long-term impairments. We don't mean short-term impairments. While in humanitarian action, the barriers sometimes are the same. Now, looking on this concept from a slightly different angle in the concept of humanitarian action, and with a focus on protection, we can say that persons with impairments in the interaction with barriers face a risk. And for us as humanitarian actors, our objective is to reduce risks and to not put persons in humanitarian settings to harm. So to reduce risks for persons with disabilities, we need to remove barriers. And we need to set up enablers, facilitators instead of barriers for persons with disabilities, so they face a situation of resilience, safety, and protection. What does that mean? In inclusive humanitarian action, in general, we talk about, on the one hand, to remove barriers as much as possible and to set up enablers, and on the other hand, to address specific requirements of persons with disabilities and to ensure the empowerment and meaningful participation of them. But we have to address as well one of the stigmas we have as humanitarian actors, that people with disabilities are automatically vulnerable. They're not automatically vulnerable, but because of barriers, especially discrimination and lack of accessibility to services, we put them at more risk and we put exposing them to vulnerabilities. So this is very important to understand. They're not automatically vulnerable, but they're made vulnerable by barriers. Why is this necessary? When we look on the general population of the world, the estimation is that 15% of every population around the world has a disability, is facing a disability throughout their life or at one point of their lives. Disaggregated on gender and age, we see that women with disability have a higher prevalence, around 19.2% or 1 in 5. The older a person gets, the more likely it gets that a person has a disability, is experiencing a disability. The younger a person is, the less likely it is, but still children with disability is a huge concern, especially from the protection angle. Those general estimations for the global world's population we expect them to be worsened in a humanitarian context. We see data now that in a humanitarian context, especially context of war or human-made conflicts, that the prevalence of persons with disability is rising up to 25-29% from recent data from Syria, for example. We see a heightened risk of violence, exploitation, and abuse, especially targeted to persons with disabilities. And we as Humanitarian Inclusion see through different reports, different studies and researches, that the majority of persons with disabilities report that they don't have an adequate access to basic services like water, shelter, food, health services in a humanitarian response. So these are very staggering numbers, and we need to address them and keep that in mind. But we shouldn't only look at disability, but we should take an intersectional approach, because a person with disability is not only a person with disability, but it's a person, either a woman, a self-identified woman with a disability, or a self-identified man with disability, might be a child with disability, might be an older person with disability, or might be from a different ethnic group with previous experience of discrimination. So we shouldn't be silent, we shouldn't only look at one characteristic, but we should take an intersectional approach. And here's just one slide with an example. When we look just with the disability lens, we see that a person with disability has up to 3 times higher risks in development and humanitarian settings. When we add the gender lens, we see that women with disabilities have up to 10 times higher risks in development and humanitarian settings to face additional risks, especially gender-based violence. So we see that we have to look at the whole spectrum and have to make a protection assessment inclusive of persons with disabilities. But we've seen that until now, this is not systematically considered and systematically included in a humanitarian response. So it's usually these approaches are ad hoc still. And as well, we see that we have limited capacity and resource allocations towards disability mainstreaming in humanitarian action. So we need a coherent approach to implementation and also to monitoring. And herewith, I'm coming to standards. And we'll have a look closer at the humanitarian inclusion standards for older people and people with disabilities on the one hand, and then on the other hand, the IASC guidelines, the interagency standing guidelines on inclusion of persons with disabilities in humanitarian action. We see since around 2016 great momentum on disability inclusion, on mainstream disability on a global level, but also on a national and field level within humanitarian action. And we see more and more tools and guidelines coming out since 2018, especially. For example, the IASC Protection Mainstreaming Toolkit, the UNICEF guidelines on the inclusion of children and youth with disabilities in humanitarian action, the ECHO guidance note, but also the Humanitarian Inclusion Standards 2018 and the IASC guidelines. So the Humanitarian Inclusion Standards for older people and people with disabilities are an accompanying sphere standard. So they are part of the sphere standard package. They were developed between 2015 and 2018 by the Age and Disability Consortium, which is a group of 7 agencies working to promote age and disability inclusive humanitarian assistance. And they were by now widely tested as well, and have the objectives to strengthen the accountability to persons with disabilities and older people in humanitarian assistance, to support their meaningful participation in the response, to promote inclusive humanitarian action in general, and to guide humanitarian programmers, so humanitarian actors who program, design projects, as well as the implementers. And they also can be used as a resource for training. But they are not designed to be used as a standalone package, but they're designed to be used in conjunction with other international standards, such as the sphere standards, the protection principles, the core humanitarian standards, etc. Throughout the whole standards, we have 3 cross-cutting topics that are addressed. The one is data and information management. So how disaggregated data on age, gender, and disability, and how to use it. Addressing barriers, what I said in the beginning, so really to remove barriers, to not put new barriers up, and to how to ensure participation and strengthening of capacities of persons with disabilities in a humanitarian setting. The first standards are the key inclusion standards of the HIS. These mirroring the 9 commitments of the core humanitarian standards, the CHS, and are adapted to the requirements and specific needs of older people and persons with disabilities. They go along identification of persons with disabilities and older people, safe and equitable access, resilience, knowledge and participation, feedback and complaint mechanisms, coordination, learning, human resources, and resource management. And then afterwards, you have 7 sector-specific standards. So for every sector, be it protection, WASH, etc., you have sector-specific standards with specific guidance, etc. And here I would like to look specifically in the protection chapter with you guys. And in the protection chapter, we can find 3 protection inclusion standards with key actions. I took a screenshot out from the first standard, which says older people and people with disabilities have their protection concerns and capacities identified and monitored, and are followed by 2 key actions, which then are further explained and are followed by key guidance notes, how to do it with technical recommendations. For example, how to monitor access rates, how to identify protection risks, how to ensure the safety of protection centers, in protection centers, and safe spaces. So they're always on a lower level, on a more detailed level. They are broken down. They have recommendations for indicators to measure the progress. And every chapter has a case study with practical examples to make it more practical and to understand really what it is meant, and a section on resources for specific tools for the protection chapter and for the different standards. The other protection inclusion standards are addressing concerns and barriers so that older people and people with disabilities with protection concerns have access to protection services and are protected from risks of physical and psychological harm. And then participation and empowerment. Older people and people with disabilities are included in prevention of violence, exploitation, and abuse, and in empowerment activities. Exactly. So these are the protection inclusion standards from the HIS. And as we said, we need to look at them and we need to use them in conjunction with other standards and other guidelines. And here I would like to briefly talk about the IASC guidelines, which were launched last year. While the HIS provides standards with technical recommendations on the project cycle management level, the IASC guidelines provide overall strategies and practical tips on the humanitarian program cycle. These are very practical, is a very practical tool as well. The objectives of the IASC guidelines are really to set out essential actions that humanitarian actors must take in order to effectively identify and respond to the needs and rights of persons with disabilities who are most at risk of being left behind in humanitarian action. And the objectives are broken down to 4 pillars: guidance, capacity, accountability, and meaningful participation. The key approaches throughout the guidelines are similar to the ones from HIS. So it's to promote the meaningful participation of persons with disabilities, to remove barriers, to not set up new barriers, to empower persons with disabilities and support them to develop the capacities, and to disaggregate data to monitor inclusion on gender, age, and disability at least. Altogether, the guidelines are set up into 18 chapters and 7 annexes. I don't want to go too deep in that, looking at the time as well, but I really recommend to look into it. It's very easy to be read. You can easily find your chapters of concern, looking at the protection chapter as well. Every chapter is set up into an introduction part, into key terms and key barriers are set up, listed. Main standards and guidelines from other policy frameworks are listed. And then you find a list of must-dos and key recommendations broken down into the different phases of a humanitarian response and into the different phases of humanitarian program cycle. Now looking at the recap. So what are we doing? All standards and guidelines should be used to influence different levels of change. So when we look at the programming level, we can look at the project cycle management level, we can look at the field implementation level, or at the wider strategies. Depending on where you want to influence, you can use different standards and different guidelines. Other guidelines cover specific topics, specific sectors, and very technical detailed things. And you should always use a combination of tools fitting to organization commitments and history. Let me finish with general challenges. Always keep in mind that rolling out standards, using standards on quality and accountability takes time and requires resources. Take a pragmatic approach, take approach of one step at a time, and don't try to do everything in the beginning perfectly. Identify in your organization perfect entry points and try to pilot maybe a project with the standards to create wins and to create good practices within your organization so you can take the next step. It is very important that disability inclusion is not only seen as the responsibility of one person or the responsibility of only the protection team, who a lot of times don't have a clear decision-making power and resources, but that it's seen as a cross-cutting topic for the whole organization, for everyone. One of the big challenges we see are the fast turnover of staff, which probably everyone knows when it comes to capacity building. This is a big challenge. We see also a challenge that, especially on frontline staff, might not to be aware of the humanitarian principle and quality standards to the full detail. So capacity building should be on the humanitarian principle as well as on disability mainstreaming. And we see challenges on the continuing funding to conduct capacity building in a humanitarian setting. General recommendations are, on the other hand, really take step by step and identify entry points in your organization and your projects. Always use an intersectionality approach to build on disability inclusion. If you have already a gender project intersected with disability, if you're already good on the core humanitarian standards, put disability in that section. Try to, in the beginning, to create quick wins and champions to pilot the further rollout and the organizational-wide rollout of the standards and the guidelines. Ensure always to have the buy-in of senior management. This is very important when it comes to change processes. And as I said a little bit before, ensure that different staff in the organization are involved and that you work on different levels with the standards, not only in the protection and in the protection sector. So now, thank you very much, and I would go over to questions.
Thank you very much, Hakon, for this great input. Another question was if there is an overview of guidelines, like is there an overview what guidelines are available for which topics? Maybe one of you knows maybe a good website which can give an overview of different protection guidelines that are available.
Yes, indeed. I mean, there are several websites. One good start is the Sphere website, where you find all the accompanying standards as well as the Sphere handbook, the core humanitarian standards, etc. So you will find the minimum child protection standards, humanitarian action there. You will find the HIS there as well. Then there are some overarching websites which I personally use quite a lot. For example, Relief Web is a very good website to check on general studies as well, on guidelines, etc. When it comes to disability inclusion, one very good website as well is asksource.info.
Yes. So now I would like to thank our two speakers for your great inputs and for sharing your experiences and recommendations for us. Also, thank you to you for taking part in the webinar, for asking your questions. I hope you could learn a few more aspects on inclusion protection and on child protection standards. And please take care of yourselves and hope to see you next time again. Have a good day. Thanks and bye.
Thanks to everyone.
Bye-bye.
Bye.
Bye.